Vending machines turned pharmacies. One is offering Plan B contraceptives. Another has sterile needles for IV drug users for sale in that vending machine.
You're kidding. So is this a good idea? Dr. Nicole Saphier is a board-certified physician here. And let's start with the needle vending machines. Doctor, does this sound like an idea whose time has come or something we got to get used to?
You know, I'd love to say this is a novel concept, but this has been going on for decades, and it's not in the United States only. It's all across the world.
Where do they do it?
We have tons of these programs. In the United States?
Anywhere.
Or where the actual vending machines, most of the time that they're associated with like drug rehabilitation centers in other countries, you actually have them in back alleyways and convenience stores in areas where people do buy their drugs.
And the idea is to do what?
So here in the United States, essentially what it is it's not to deter people from actually using IV drugs. And that we need to make that clear.
Yeah.
This is not to reduce the opioid crisis. What we're trying to do is reduce transmission of HIV and hepatitis C, which are rampant in our drug-using population.
Yeah.
So what it does, and it has proven effective. This works. If you actually provide sterile syringes and needles, we have cut HIV transmission in half amongst drug users, which is fantastic.
It's just so weird. I mean,
it's hard to wrap
needles.
It's really hard to wrap your head around this concept, but it has proven effective over and over that it is not exacerbating drug use individually or on a society, but it is cutting our HIV transmission, and that is important.
I mean, you would imagine that law enforcement might hang out with these by the vending machines and get an idea of where he or she is going.
So in the United States, using drugs is a criminal act, and that is one problem that we are facing, that people are not going to use these because they're fearing the retribution of it.
And while the cost is $10 per kit, it's actually free for the user. You got to generate some sort of a passcode, and then you just punch in your code, you get it for free.
Right, and well, that's because we don't want to deter people from using it. I mean, to treat someone for HIV is over $350,000 for lifetime. You know, long term, this is cost effective.
All right, what about UC Davis? They have Plan B. They're selling those pills for $30 in their vending machines.
Right, so on these college campus, now we're seeing that they're offering the Plan B morning after pill on the vending machines. Now, what we were talking about HIV, I do want to say Plan B does not prevent HIV. It does not prevent transmission. And selling this in a vending machine is not a religious or women's rights topic, because right now, federal rule is you have access to this. We are able to get Plan B. So what the problem I see with this is you have these young people who, by the way, less than 24 years of age is 25% of our new HIV diagnoses.
Wow.
A quarter of the United States population of HIV is coming from our high school and college age kids. So if we're giving Plan B, these kids now may think, okay, well, now I'm not running the risk of getting pregnant, so maybe I'm not even going to use condoms. So what is this going to do to our HIV transmission and other STDs? Are kids just going to make their safe sex practices based on a vending machine selection, and they're no longer going to talk to their mentors or healthcare professionals?
Here's what UC Davis said in explaining why they're doing this.
The Wellness Machine was a student-led initiative for another access point to healthcare items, as it is available to students, faculty, and staff for extended time beyond traditional business hours.
So it makes it more convenient.
More convenient, not necessarily sure it's good for the long run.
Doesn't
Very controversial.
prevent disease, just prevents pregnancy.
Exactly.
All right. Doctor, thank you very much.
Thank you, guys.
Interesting stuff.